Hello again, everyone. Mark Hackel, Macomb County Executive. Just trying to give you a quick explanation and simplify this issue dealing with vaccines. In Macomb County, what we're trying to do on our website, full transparency, the number of vaccines we get from the state, we will tell you week by week what we've been able to get. And then what we do is we put out there how many vaccines we've gotten to date so far, those that have been administered, and then those that are going to be getting the vaccine. So obviously if you add the two up, administered and appointments that are scheduled, it equals the number we get from the state. So every dose we get gets out to the public, and the public meaning those that are eligible. And eligible is based upon, if you will, occupations as well as age categories of our seniors, which I believe are the most vulnerable and should be the specific category we're looking at when you're talking about limited doses. The challenge is, over the past couple of weeks, we've been getting less doses. Well, every Friday, much like this past Friday, we wait to see what the state is going to allot to us. Every time we see this number, we're hoping that we're going to get more. We ask for 50,000 a week. We have to the federal government, and we're asking the state for 50,000. This limits our potential. Well, our potential got severely limited this past week. What did we see? Well, if you look, the first allotment that we got when they opened it up to the masses was 7,750. Then this past week, they decided to give us 6,250, which was kind of shocking enough. But then all of a sudden this week, Friday, we now have only 4,700 to administer to the incredible number of folks that they've opened us up to. That creates an incredible amount of tension for people that want to get vaccinated, but more, I think, so for seniors. And I think it really puts them in harm's way because they have to compete with all these other occupations where people are far younger than they are and maybe not as susceptible to dying as a result of getting the COVID virus. And so when we looked at the state's data and we try to understand this vulnerability index, there's nothing in there that talks about anything as far as data collected that would show that anyone is more comprised or compromised as a result of this than age categories. So we looked at occupations. There's nothing there that says occupations. There's something that would indicate somebody's more at risk and could die from this. You know, there's a debate as to who's essential versus non-essential. Set that aside. Let's get back to the real issue. The real issue is when we talk about the deaths. Who has died as a result of contracting this and who is more vulnerable or susceptible to that? This is state data, and we talk about following the data and the science at the state level. Well, let's do that. And when you think about people that are 60 years of age and older, obviously the highest category of deaths, if they contract the virus, is 80 plus, and then obviously the 70 to 79, but 60 plus. So take the 60 and older category, folks that are 60 years of age or older. That consists of or comprises of 90% of the deaths so far as a result of catching the COVID virus. So they are the most vulnerable, the most susceptible, 60 years age and older. Well, when we look at Macomb County's numbers, very consistent. In fact, once again, 90% of the deaths are as a result of people that happen to catch this that are 60 years of age or older. So the question is, why aren't we focusing our attention specifically on those age categories and trying to find out with the very limited doses that we're getting, how do we address that so we keep them out of harm's way? We know the congregative care issue, and that there was a very problem or challenge with the congregative care facilities and the deaths that resulted about having people in those facilities. Well, you'd think lesson learned from that we'd focus our attention on our seniors and do the same thing. But here in Macomb County, we'll continue to give out whatever the state gives us. The state wants to go ahead and give us 4,700, we'll get those into the arms of folks. And if it's open up to various categories, we'll do that. But we know we can do a better job. We know we have the potential to do that with our partnerships. We can do something specific for teachers at the ISD. We're ready to go, we're geared up, we can make that happen. We could do it for police and fire at their locations throughout the entire county. We could do it for municipal workers or the general public. We can open it up to everyone. But more importantly, how do we address the issue of taking care of the folks that are most compromised, our seniors? Well, if we get 50,000 doses a week, we can set up programs specific to each one of those. But I certainly can't do it when I'm only getting 4,700 doses. Why? Because when you open it up to the various occupations that it's been opened up to, and you open it up to the senior categories that we've opened it up to, you're talking upwards 250,000 people that are eligible for 4,700 doses from our health department. If people get frustrated because now we opened up our phone lines today, we opened up the website today, and within 9 minutes, those that were on the website were already spoken for. It took about 2 hours to deal with those that were calling in on a phone line. And then people are frustrated, they're angry, they're upset. We keep trying to tell them, I can only give out what I get from the state. I can do 50,000, but they're only giving me 4,700. So what we're trying to tell people is, you know what, we're probably one of very few outlets that are available that have a vaccine. Here are some others that have vaccines available. But again, I'm just going to have to forewarn you, very limited supply from each of these folks too. They're saying the same thing, get us the vaccines. We've opened it up to far too many categories, putting our seniors at risk. So here in Macomb County, we're trying to figure out how do we work on some of these partnerships, not only preparing ourselves, but trying to get it out there to see if we can't get that vulnerable population, and that vulnerable population is seniors. You know, unfortunately, we hear that they're distributing it based upon some kind of vulnerability index. I don't know what more vulnerability index they need than their own statistics talking about the most vulnerable, and that's our senior citizens here in Macomb County. And we have an incredibly large number of folks that meet that category here in Macomb County that really want this vaccine. So we're going to continue to champion on their behalf. We're going to continue to push on their behalf. My suggestion is, if you have a chance, maybe reach out to a state legislator and say, you know what, do more on behalf of our seniors here in Macomb County. Get the county the 50,000 doses a week they're asking for, because put us to the test. We can make that happen, and we will satisfy and we'll solve the problems of trying to figure out how do we vaccinate those that want it in those various occupation categories. But more importantly, we're going to take care of our seniors here in Macomb County. But I certainly can't do it if this is all we're getting from the state, and if our state legislators are satisfied with that, you know, that I guess there isn't much more we can do. But the reality is, we know we can do more, we can do better. So this is kind of a challenge to our state legislators. Start talking on behalf of Macomb County residents. Get us more vaccines here in Macomb County. We know we can do more, and we know we can satisfy the state's requirement of vaccinating those in those various occupations, as well as our seniors here in Macomb County. So we stand ready. We'll give out whatever the state gives us, but we know we can do far more. So with that, I just want to continue to remind you to keep you and your family safe in the meantime.